Over 35,000 people were studied. The results were clear. Cannabis users had significantly lower blood pressure than non-users. The research exists, it's published, it's peer-reviewed. Yet your cardiologist has probably never read it, your primary care doctor has never mentioned it, and your pharmacist certainly isn't going to bring it up when you pick up your prescription. This isn't a conspiracy. It's something worse. Institutional ignorance combined with decades of propaganda that convinced everyone, including doctors, that cannabis only destroys health, never improves it. What you're about to discover could fundamentally change how you manage your cardiovascular health. But first, you need to understand why this information has been kept from you. Something that's been used for thousands of years, that's showing remarkable promise in clinical research, but that remains largely ignored by mainstream medicine because of politics, stigma, and decades of prohibition. Cannabis and its relationship with blood pressure is far more complex, nuanced, and potentially beneficial than the simplistic warnings found on Google or received from cardiologists. This is what doctors won't tell patients about cannabis and blood pressure, not because they're hiding it, but because most genuinely don't know. And for people dealing with hypertension, pre-hypertension, or cardiovascular concerns, this information could change everything. Let's be absolutely clear from the start. This isn't medical advice telling people to stop taking blood pressure medication or to use cannabis instead of proven treatments. This is information backed by research but rarely discussed in medical offices because people deserve to know all their options when it comes to cardiovascular health. High blood pressure, hypertension, is called the silent killer for good reason. It usually has no symptoms. People feel fine. Meanwhile, it's quietly damaging arteries, straining hearts, increasing risk of catastrophic cardiovascular events. The standard treatment approach is pharmaceutical intervention. ACE inhibitors, beta blockers, calcium channel blockers, diuretics. Medicine has an impressive arsenal of blood pressure medications, and they work. They save lives. Millions of people manage their hypertension successfully with these drugs. But these medications come with side effects. Some people experience fatigue, dizziness, sexual dysfunction, persistent cough, electrolyte imbalances, or metabolic changes. Many people need multiple medications to control their blood pressure, compounding the side effect burden. And here's what really frustrates many patients. The pharmaceutical approach treats the symptom, elevated pressure, without always addressing underlying causes. Chronic inflammation, endothelial dysfunction, oxidative stress, autonomic nervous system imbalance. These are the root issues driving hypertension in many people, and they're often left unaddressed while numbers are just chemically forced down. Cannabis works differently. It doesn't just mask symptoms, it appears to address multiple underlying mechanisms simultaneously, and the research, while still emerging, is genuinely compelling. Searching for information about cannabis and blood pressure online reveals contradictory information everywhere. Some sources claim cannabis raises blood pressure. Others say it lowers it. Some say it's dangerous for people with cardiovascular issues. Others cite research showing cardiovascular benefits. The confusion comes from the fact that all of these statements are partially true, depending on dosage, frequency of use, ratio of cannabinoids, individual physiology, and timing. Cannabis's effects on blood pressure aren't simple or uniform. They're complex and highly variable. Here's what the research actually shows. Acute cannabis use, especially in people who aren't regular users, can cause a temporary increase in heart rate and, in some cases, a slight temporary increase in blood pressure. This happens primarily with high THC products and is most pronounced in the first 15 to 30 minutes after consumption. However, and this is the critical part, this acute response doesn't predict long-term effects. Regular cannabis users show a different pattern entirely. With consistent use, the cardiovascular system adapts. Heart rate changes diminish, blood pressure responses normalize, and something interesting happens. Chronic cannabis use is associated with lower blood pressure, not higher. Multiple large-scale population studies have found that regular cannabis users have lower rates of hypertension than non-users. One study of over 35,000 adults found that current cannabis users had significantly lower blood pressure readings than non-users, even after controlling for other variables like diet, exercise, and body weight. Clinical research is revealing the mechanisms behind this effect. Cannabis, specifically the endocannabinoid system it interacts with, plays a crucial role in cardiovascular regulation. The endocannabinoid system helps control vascular tone, inflammation, oxidative stress, and autonomic nervous system balance, all factors that directly influence blood pressure. When this system functions optimally, blood pressure tends to normalize. When it's deficient or dysregulated, cardiovascular problems often follow. And here's the key insight. Many people with hypertension show evidence of endocannabinoid system dysfunction. Their bodies aren't producing adequate endocannabinoids or responding to them properly. Cannabis supplementation, providing external cannabinoids, can restore function to this system, addressing the underlying dysfunction rather than just forcing blood pressure down through pharmaceutical mechanisms. CBD, the non-intoxicating cannabinoid, has particularly strong evidence for cardiovascular benefits. Research shows that CBD reduces inflammation in blood vessel walls, decreases oxidative stress, improves endothelial function, promotes vasodilation, and reduces stress and anxiety, all of which contribute to blood pressure control. One study gave healthy volunteers CBD and then subjected them to stress tests designed to spike blood pressure. The participants who received CBD showed significantly lower blood pressure responses to stress compared to placebo. Their cardiovascular systems were more resilient, less reactive. Another study found that a single dose of CBD reduced resting blood pressure and reduced the blood pressure spike during stress in healthy subjects. The effects were dose-dependent and reproducible. THC has a more complex relationship with cardiovascular function, but emerging research suggests that in the right doses and contexts, it too may offer benefits. Low-dose THC appears to reduce sympathetic nervous system activity, the fight-or-flight response that drives much stress-related hypertension. Many people have started incorporating cannabis into their health routines, specifically for blood pressure management, after months of research and consultation with cannabis-knowledgeable healthcare providers. The approach doesn't involve just stopping prescribed medication and switching to cannabis. That would be dangerous and irresponsible. Instead, the protocol typically starts with CBD oil, a high-quality, third-party tested product with verified cannabinoid content. Many begin with 25 milliliters of CBD twice daily, once in the morning and once in the evening. Within 2 weeks, home blood pressure readings often start trending downward. Not dramatically, perhaps 5 to 8 points, but consistently. More importantly, blood pressure becomes more stable throughout the day, with less variation between readings. After a month, some people add a small amount of THC, about 2.5 milliliters combined with CBD in the evening. Evening is often chosen because that's when blood pressure tends to be highest for many people and when daily stress has accumulated. 3 months into this protocol, many people see their blood pressure drop from concerning levels like 156/98 to more manageable numbers around 138/86. Still not perfect, but significantly better. And other changes occur too. Sleep improves, which matters because poor sleep drives hypertension. Stress response feels more balanced. Reactivity to daily frustrations decreases. At 6-month follow-ups, blood pressure readings often reach into healthy ranges, around 128/82. Doctors are typically pleased with the improvement and often attribute it to the prescription medication, especially if patients haven't disclosed cannabis use. After a year of consistent use, some people are able to completely discontinue prescription blood pressure medication under medical supervision. Blood pressure stabilizes in normal healthy ranges, around 122/78, and stays there with continued cannabis use. The specifics of effective protocols matter enormously. Random cannabis use won't reliably produce blood pressure benefits. This is about strategic, informed use. Most successful protocols involve 25 milliliters of CBD twice daily, morning and evening. This provides consistent anti-inflammatory and vascular benefits throughout the day. The CBD used should be from reputable companies with full third-party testing showing cannabinoid content and absence of contaminants. In the evening, many people add 2.5 to 5 milliliters of THC along with CBD. This dose is low enough that significant intoxication doesn't occur, just relaxation. This combination helps with stress management and sleep quality, both critical for blood pressure control. Some people use CBD topically on temples and neck when feeling tension building. While this probably doesn't directly affect blood pressure, it helps manage stress responses that can spike pressure. Daily blood pressure monitoring with quality home monitors is essential. This isn't optional. Objective tracking is necessary rather than relying on how people feel. Blood pressure can be dangerously high without symptoms. Other cardiovascular health practices must be maintained: regular exercise, Mediterranean-style diet, stress management, adequate sleep, limited alcohol. Cannabis doesn't replace these foundations, it enhances them. The combination of lifestyle interventions plus cannabis often provides better blood pressure control than medication alone achieved, without the side effects experienced from prescription drugs. Cannabis's effects on blood pressure are highly individual and dose-dependent. What works for one person might not work identically for another. Some people need more CBD, some need less. Some do better with higher CBD-THC ratios, others with balanced ratios. This requires experimentation under proper supervision, with consistent monitoring, and with patience. Blood pressure doesn't normalize overnight. The objections and concerns are predictable, so let's address them directly with honesty and nuance. Doesn't cannabis increase heart rate and blood pressure? In acute use, especially with high THC products in non-tolerant users, yes, it can. This is why starting low and slow is essential, why high-dose THC products should be avoided with cardiovascular concerns, and why working with knowledgeable providers matters. The acute response doesn't predict chronic effects. Isn't cannabis dangerous for people with heart disease? The research here is mixed and complex. There are case reports of cardiovascular events in cannabis users, but population-level data shows cannabis users actually have lower rates of cardiovascular disease. The relationship is complicated by factors like smoking versus other consumption methods, dose, frequency, and individual cardiovascular risk profiles. People with significant cardiovascular disease should absolutely consult with cardiologists before using cannabis. But blanket statements that cannabis is dangerous for heart health don't align with the emerging research picture. Don't blood pressure medications work better? For some people, yes. Pharmaceutical interventions are powerful, fast-acting, and well-studied. They're absolutely appropriate for many situations, especially severe hypertension that needs rapid control. But better depends on definition. If meaning faster symptom suppression, pharmaceuticals often win. If meaning addressing underlying mechanisms, improving overall cardiovascular health, minimizing side effects, and supporting long-term wellness, cannabis may offer advantages. Isn't this just replacing one drug with another? In a sense, yes. But there's a meaningful difference between pharmaceuticals that force physiological changes through targeted receptor blockade and plant medicines that support normal regulatory system function. Cannabis works with endocannabinoid systems to restore balance rather than overriding natural processes. What about drug interactions? This is a legitimate concern. Cannabis can interact with blood pressure medications, blood thinners, and other cardiovascular drugs. Cannabis cannot simply be added to existing medication regimens without professional guidance. This requires medical supervision, monitoring, and often gradual medication adjustments as cannabis effects develop. The reason doctors won't tell patients about cannabis and blood pressure isn't conspiracy or corruption. It's ignorance combined with institutional inertia. Medical education doesn't include endocannabinoid system function or cannabis therapeutics. Doctors graduate having learned almost nothing about this. Research has been suppressed by federal prohibition for decades, creating massive knowledge gaps. Clinical experience is limited because doctors have been actively discouraged from recommending or even discussing cannabis. The result is a medical establishment that knows pharmaceutical interventions extremely well, but knows almost nothing about plant-based alternatives that might be equally or more effective with better side effect profiles. Meanwhile, millions of people are taking blood pressure medications with significant side effects, never hearing that there might be another option worth exploring. This information gap is slowly closing. Research is accelerating. Medical schools are starting to include endocannabinoid system education. Doctors in legal states are gaining clinical experience, but the pace is frustratingly slow for people suffering right now. Patients shouldn't have to become their own researchers to find out about legitimate therapeutic options. They should be able to have informed conversations with doctors about all available approaches to managing health conditions. But until the system catches up, patient education and self-advocacy remain essential. For people dealing with high blood pressure and interested in exploring cannabis as part of management strategy, here's what needs to be known. Never stop current medications without medical supervision. Abruptly, discontinuing blood pressure medication can be dangerous. Any changes need to happen gradually under professional guidance. Start with CBD only initially. Pure CBD has cardiovascular benefits without concerns associated with THC. Begin with 15-25 milliliters twice daily and track blood pressure responses for at least a month. If deciding to add THC, start with very low doses, 2.5 milliliters or less, and preferably in the evening. Monitor carefully for any adverse cardiovascular responses. Track objectively. Get a quality home blood pressure monitor and check daily at consistent times. Keep a log. Don't rely on how you feel. Blood pressure doesn't have reliable symptoms. Work with knowledgeable providers. Find doctors or healthcare practitioners who understand cannabis therapeutics and can provide proper guidance. They exist in legal states, though they may require searching. Be patient. Cardiovascular benefits from cannabis develop over weeks to months, not days. This isn't a quick fix, it's a long-term strategy. Consider comprehensive approaches. Cannabis works best as part of broader cardiovascular health strategy, including diet, exercise, stress management, and sleep optimization. Quality matters enormously. Use third-party tested products from reputable companies. The cannabis market is full of mislabeled products and contaminated oils. Verify what's being consumed. Most importantly, be informed. Read the research. Understand both benefits and risks. Make decisions based on evidence, not hype or fear. Cannabis isn't a magic bullet for high blood pressure. It's not. Cardiovascular health is complex and multifactorial. No single intervention fixes everything. But cannabis, used properly at appropriate doses as part of comprehensive health management, can be a powerful tool for blood pressure control that many people never hear about from their doctors. Thousands of people now maintain blood pressure consistently in healthy ranges without pharmaceutical medication, with no side effects, while also enjoying better sleep, lower stress, and improved overall well-being. Cannabis made this possible when conventional treatment alone wasn't achieving these results. People deserve to know this option exists. They deserve to have informed conversations with healthcare providers about all available approaches to managing cardiovascular health. And they deserve access to research-backed alternatives that might work better for individual situations than standard pharmaceutical protocols. Doctors won't tell patients this about cannabis and blood pressure, not because they're hiding it, but because they don't know. Now you do. What anyone does with that information is their choice, but at least the choice exists.